president is hitting primetime tonight to try to sell health care reform. Senior White House correspondent Major Garrett reports that even a president with plenty of political capital and popular appeal is finding it a tough sell.
I look forward to working with them to get this done for the American people.
The bipartisan governors' meeting continued the drumbeat of White House lobbying for national health care. But a slew of choreographed events and televised interviews has yet to dislodge public skepticism about the side effects of a bigger role for Uncle Sam. The latest Washington Post ABC News poll shows 88% are concerned that reform will increase their health care costs, 84% that it will sharply increase the deficit, 81% that it will reduce the quality of their health care, and 79% that it could limit their choice of doctors and treatments. Still, Mr. Obama predicted victory this year.
Absolutely.
If you don't, is it over for 4 years?
We're going to get it done. So I won't engage in hypotheticals in which we don't.
The president's interview, part of ABC's day-long health care coverage at the White House, capped off with tonight's primetime town hall. The senior advisors blame the bad health care poll numbers on myths they say have left Americans confused.
It is a complex and difficult issue to work through in order to make sure that people understand.
Snared in that complexity, Senate Democrats who are falling way behind schedule. Connecticut's Christopher Dodd said today he won't, as promised, pass a health care reform bill out of his committee before the July 4th recess.
I would love to complete all of it, but realistically it may be impossible to get all of that done.
The big issue? Cost estimates on parts of the bill being rewritten after the Congressional Budget Office projected, or in Beltway lingo, scored, a price tag of $1.3 trillion.
We still need to get numbers. Obviously, I can't bring up sections of a bill that have not been scored, so we know the impact financially of what we're suggesting.
Meanwhile, the Senate Republican leader laid down 5 questions for the White House on health reform. 2 of them: will Mr. Obama prevent the rationing of health care, and will he embrace preventative medicine? The other 3?
Will the president use his veto pen to make sure Americans aren't kicked off their current health plans? Will he oppose any legislation that increases the nation's deficit? Will he oppose any bill that raises taxes on middle-class families?
Republicans say the president's losing momentum, but here's something for them to think about. That same Washington Post ABC News poll found by a 55% to 27% margin, the public trusts Mr. Obama more than congressional Republicans on health care reform. Brett?
Major Garrett live on the North Lawn. We've told you a lot lately about what health care reform might look like. Tonight, Chief Washington correspondent Jim Angle looks at one option that seems to be a long shot.
The House is debating health care on several fronts, with some experts and members of Congress still pushing something even the president says will not happen: a single-payer, government-run health care system for all.
The single-payer national health insurance is not just the only path to universal coverage. It is the most politically feasible path to health care for all.
In another committee, Sidney Wolf of Public Citizen criticized President Obama for not embracing single-payer, saying it is the only choice.
It's the only practical way national health insurance will ever happen.
Because of overwhelming evidence that lesser reforms, even with robust public plan option, lesser reforms will fail.
But by all accounts, a single-payer government-run plan has very little support in Congress. The House is focused instead on a more limited proposal for a government-run option that would compete with private plans.
We believe strongly that you need a public insurance option to introduce competition into the marketplace.
But that also hit a snag. Private group estimated the cost over the next 10 years.
This bill is actually worth $3.5 trillion. And let me repeat that for everyone here, especially the members who've not been given any information on the cost. An independent, nonpartisan analysis says this bill costs $3.5 trillion.
The bill itself does not estimate the cost or specify any revenues, saying only that they are to be provided. That independent analysis from a group called HSI Network from Minnesota found that the Democratic proposal in question would cover 97% of the uninsured, but it would also result in 64 million Americans shifted from employer-provided insurance because the government plan would be cheaper, though not necessarily better.
It's kind of like my 7-year-old daughter's lemonade stand competing against McDonald's.
But some Democrats bristled at criticism of the government's involvement in health care.
It's amazing how the language in opposition to this bill is basically the same language that was heard with Medicaid and Medicare.
Medicare, the biggest government insurance option, offers care to tens of millions, but it also has $36 trillion in unfunded liabilities, meaning that's how much it would cost to cover all the promises Congress made, but doesn't have the money to pay for. Brett?
Okay, Jim. Thank you.